GM, welcome to VaultMedics. In healthcare, records are often scattered across hospital, paper, documents, and different platforms, which VaultMedics fixes by having a one secure vault for all medical records of a patient, having an AI that reports or explain all the reports in a plain language for a full understanding, a full audit trail of every event or activities that happens on the patient's dashboard, and also a blockchain verified document for integrity on both network. The healthcare provider, patient can have access to their dashboard. What they need to do is to connect their wallet and to be able to access anybody that assigned them to a particular record. So this is how VaultMedics works. As a patient, after you uploaded some of your medical records and you need an advice or you need a medical attention from a medical practitioner or a medical provider or an healthcare provider, you uploading some new records. If you have a document, you can use it to back this up. Documents attachment is very optional. In case I can either attach a PDF or a picture. Any of the documents is acceptable. So I'm attaching this PNG, then I upload. So this is the one we just uploaded now. We choose. So this document, we can view it here ourselves, and this is showing that this particular record is not on chain. Now I want to attest this thing. Assigned. VaultMedics is AI powered, which every record you upload, you can get a summary in it. So yeah, it's showing that it has been verified on chain in our X timeline. Also, AI assistant is when this one is when you will be able to chat directly with an AI. Now this AI is trained that it doesn't give a medical advice, it only gives a suggestion and it only clarifies things that you do not know about medical assistance. Then for the permission, this is where an healthcare or a doctor healthcare provider comes in, where anybody that registers as a healthcare provider will be viewed, and anyone that you want to grant access to your records or to your database will be granted access to. Now currently I only have this Mr. Newton, and the specialty is the pathology, and this is the provider wallet address. This provider wallet address. So if I want to grant this person an access to my records, I just need to copy the address. And come here, paste the address, change the duration to anytime you want. So this will automatically revoke the access once this timestamp is met, or you revoke it yourself manually. I like to say it to just 1 hour. So I'm consenting that proof should be feasible to the provider. Only the provider will be feasible to nobody else. Now that I've signed I've granted my consent for this particular provider, I can see it here, and also I can revoke this person access whenever I want if the time is not reached yet and I feel like maybe he has done whatever I need to do, and I just revoke the access immediately. And is the one that holds your personal information like log group, genotype, and all that. So this is the only thing that you can share outside VaultMedics. VaultMedics. So now that I've been able to give this provider, this pathologist, an access to my record. Now let me log in as this particular provider, connecting my wallet. Now that I've connected my wallet, so I can see that this particular wallet has granted me an access to his or her records. So all I need to do is copy the address, paste it here, verify it. Just need to retry. It was not granted. I was not granted. I won't be able to see any of this. Now these are the 3 documents, 3 records that's on this particular person. On this particular person dashboard, I've been able to see the 3 of them. So before I grant this person access, all I need to do, or after I've granted this person access, all I need to do is I should disactivate this red code at this particular point in time, so this particular provider won't be able to see it. Once I disactivate this particular record, now if I reload and try to check in again, I won't be able to see so I can only see 2, which the patient feel like it concerns the patient. And from here, I can decrypt. Before I can view the documents being attached, I need to decrypt, sign a transaction before I can see the particular document, because when we are uploading, the document has been hashed and the hashed results have been saved, not the particular document that has been saved. So before I be able to see it, I have to sign the transaction and use the transaction hash to be able to fetch the document, or to gather the document all together. So this is the document that has been decrypted and it's showing. So this is the picture that I uploaded when I was creating a test for demo. Close. I've been able to see the descriptions, and when I've been able to view the records, I can input some of as a provider, input their views, like, or their advice or something. Let me say stop eating late at night. That is my conclusion or something. I can write as many as I want, and once I save the document, the patient will be able to view it under the record. And also I can also view this. I can view the documents attached to this record. Okay, this is a PDF. Now you come back here and view. I'll be able to see the notes sent by the provider. Okay, I'll be able to view the notes sent by the provider. So even after we revoke this person access and grant another person access, and the person also give their note, I will still be able to see it. Thank you.